the regulatory hurdles also for entering international markets are going up and up all the time. And this is in part because all of us have a pretty irrational approach to the risk of pharmaceuticals. So we cheerfully get in our cars and take risks that people 100 years ago would have thought were insane. But the far smaller risks associated with some medicines we find intolerable. So the regulatory barriers go up and up and up, which makes it more and more difficult for small companies who want to compete beyond the domestic market to enter those markets.
So why have the Chinese not been so big in generic drug manufacturing?
The Chinese have very big plans in medicines and in vaccines, and certainly within the domestic market in China, they're dominant. And certainly it appears that their plans are to steadily increase their presence globally in medicines and in vaccines. I think historically there have been concerns about the strength of the Chinese regulatory system. And so it has been difficult for Chinese manufacturers to convince other regulatory authorities that their own regulatory systems are sufficiently robust
to guarantee the standards.
And there is a concern, whether warranted or not, and I'm not an expert in China, but there is a concern that it's difficult for whistleblowers in China to come forward and to say, the company tells you they're doing this, they're actually doing this. Whereas in India, which has a vibrantly free
lively and noisy.
Lively and noisy. The slightest hint is cheerfully picked up by, any number of media outlets and splashed on the front page, as it is here and in the US, of course.
In theory, these generic manufacturers produce cheaper drugs through the process of competition. But you were saying earlier you were in Brazil and you discovered that the generic drug manufacturers there you actually had to buy some drugs yourself, and they were very expensive.
Yeah, I did. I mean, I sort of knew this I knew this theoretically before, that Brazil in many categories has some of the most expensive generic drugs in the world. Or, for example, Peru, the average generic prices in Peru are higher than they are in Canada, which is insane, and points to market inefficiencies of various kinds. It was brought home to me because I had a slip disc in Brazil. I happened to speak quite good Portuguese. I had no trouble discussing with the pharmacist why my prescription medicines cost what they did, but they cost an absolute fortune compared to what they would have cost in the UK. So it was...
you were personally at the sharp end of that one.
Robustly brought home to me, yes.
And generics are particularly important because they deliver medicines and treatments to poorer countries at a price that is much more affordable. So there is obviously a discussion that goes on between the price of access to drugs, whether patent or generic, in rich countries, middle-income countries and poor countries. Describe to me how that plays out.
Well, let's be clear that the generics industries actually have multiple roles. So the vast majority of medicines dispensed by the National Health Service in Britain are generic. The vast majority of medicines dispensed to American patients are generic and are very cheap. And so it's a very important role that those companies play. And were it not for an international generics market, in industrialized countries, we would find the medicines bill for long-established medicines unaffordable. So that's one very distinct role they play. A second, I think much more difficult to assess role is the extent to which generic manufacturers make medicines affordable in poorer countries. Now you can point to a couple of examples where undoubtedly generic medicines have driven down the prices very fast. Access to HIV medicines is the best known of these. Although, I think, misleading. How much are the generic companies driving down the cost of essential medicines in the poorest countries? The answer is not nearly as much as they should be.
Why is that?
I think the sort of market inefficiencies we were talking about before, that countries may put regulatory hurdles in the way, one wholesaler may dominate a country, the retail market may have unacceptably high markups because you don't have effective retail competition, hospitals may mark up drugs, which is a big problem in many places.
So the market blockages, in a sense, move to the national rather than the international level.
Or even the local, yes, that's right, or even the regional and the local level. And then you've got to remember that a lot of countries actually, bizarre as it sounds, tax medicines. So I mean, across most of Africa, you have sales taxes on medicines. Brazil imposes sales taxes on some medicines. So states themselves are often responsible for driving up the cost of medicines, either through sales taxes or import duties or other state fees. So in fact, many basic medicines should be much cheaper than they are. Certainly in the retail market in the poorest countries. I mean, I think public health systems probably these days do get access
at a reasonable price.
Yeah, to pretty low prices.
And the majority of drugs now in poor countries are available as generics. There's not a great shortfall in treatments at this point.
It depends what you're talking about. I mean, certainly if you're talking about what we've traditionally thought of as the major public health problems, then that's right. I was actually involved with a group of pharmaceutical companies who said we need to do something about a specific set of diseases and we need to make medicines more accessible. And after a few months it dawned on us, the horrible truth dawned on us, that these companies actually had nothing to offer, because all of the medicines that were being used in the poor countries they were targeting in this particular set of diseases were in fact available generically at prices far below those that any of the innovative multinational companies could have afforded to sell at. So if you think about bacterial illnesses, you think about diarrhea, pneumonia, the traditional big killers from a public health perspective. Most of those can be treated by medicines which are available in generic form. And as I said, it may be that in industrialized countries we have forms of those medicines that are slightly more convenient, slightly more tolerable, and are still on patent, but the core medicines no.